Though we have begun living an almost post-pandemic lifestyle, COVID-19 is still straining Niagara's hospitals and urgent care centers. Here to tell us more is Dr. Shira Brown. Doctor, what is being done right now to respond to the rising numbers of COVID-19 patients in the hospitals?
Hi, Mike. Great to see you today, and thank you. I'm really looking forward to talking about some of the alternative care options. I'm not going to sugarcoat it. It's really tough right now. We have a lot of healthcare staff off with COVID-19. We have a lot of inpatients, a lot of volume and acuity coming into our emergency departments. So we're really trying to focus on leveraging a lot of the alternative resources that we have for the public, such as obviously family doctors, walk-ins. But one of the new options we have available is our virtual urgent care, and we're trying to emphasize to the public to try and use that new resource. It's from the comfort of your own home. You don't have to wait in a waiting room. Great opportunity to get care in that way.
How does this actually work, and what are the circumstances where someone might turn to virtual urgent care?
Yeah, great question. So a patient just goes to urgentcareontario.ca. They put in their postal code address, and they'll be redirected to the Niagara Health website, where they'll register and see a nurse practitioner who will diagnose them, give them prescriptions, fax them to their pharmacy, leverage a physician if necessary, sometimes send them into the department. So it's a really full scope, fulsome service that we're providing.
What kind of circumstances, though? Would it be someone who's experiencing some intestinal pain, those kinds of things? Certainly not someone who thinks they might need stitches.
Yeah, so great question. Really for minor ailments like minor flu symptoms, rashes, or, you could actually, if you were wondering whether something does need a stitch, you could come in just to have it looked at and then, decide whether or not you need to come in. So even that, you could leverage urgent care. So really for anyone who needs a same-day appointment, can't get into their family doctor or doesn't have one for a non-emergency, non-life-threatening condition, that's what the urgent care is for.
Dr. Brown, what is currently being done to protect the capacity at our emergency departments?
Yeah, so we try to focus very strongly on keeping things for trauma, resuscitation, chest pain, shortness of breath, and we urge the public to, use the emergency departments for that resource. We also have our urgent care departments in Port Colborne and Fort Erie. So just trying to divert and make sure that people understand what those resources are is one of our main strategies.
Dr. Brown, there's something called Know Your Options. Is this an information sort of clearinghouse for people to make the right decisions for healthcare?
Yeah, great question. So you'll notice I have a website on the side of me here at niagarahealth.ca. If you go to / Know Your Options, you can see what resources are available to you and what's appropriate for the condition that you have.
You mentioned off the top the fact that, the healthcare system is strained and there's a lot of people who are off in many cases day by day. And I know that's the same in the education system as well. It's difficult to keep things at pre-pandemic levels when so many of the staff members are also getting ill.
Yeah, thanks for those sentiments, Mike. It is really difficult. The staff are very tired. And I think it also speaks to how important it is for us to be patient and kind to one another as this drags on for 2 or more years, right? That we have to care for each other and be kind to the people that show up to work every day and are struggling in a short-staffed environment.
Where do we go from here, and when do we think that things will be able to get back to normal? Are we looking at months? Are we looking at another year?
That's the million-dollar question, right? This virus keeps throwing us curveballs again and again. So I'm not really able to predict, but we have created a lot of infrastructure and a lot of strategies for managing this over the long term. No one wants to hear that, but we do have that. So we just need to carry on and continue functioning in the best way possible and making sure that everyone knows when they come to our departments, they'll get the best care possible.